Hi, I'm Samuel DiStefano. I'm a public health educator with the Monongalia County Health Department.
My name is Alex James, and I work for the Monongalia County Health Department as a public health educator.
My name is Clay Thorne. I'm a public health educator for the Mon County Health Department.
My name is Anita Village, and I'm a public health educator at the Monongalia County Health Department.
As a public health educator, we address issues related to accessibility, awareness, and education when it comes to COVID vaccines. We collaborate with community organizations to host vaccine clinics.
I think that we facilitate testing, clinics, research, and community engagement.
As a public health educator, my primary role is to assist people within our community, and that can range from individual community members to entire demographics.
It's important to get vaccinated. I specifically look at it from a statistical standpoint. Whenever you look at the numbers post-vaccine rollout with individuals who are not just dying, but who are in hospitals in intensive care, you'll see that the number discrepancy between those who are vaccinated and those who are not vaccinated is very prevalent.
It's the best defense. People have had doubts about it, people have had worries about it for ages. Benjamin Franklin wrote about how sad he was that one of his children died because he didn't get them inoculated against smallpox. It's nothing new for people to be afraid. It's also nothing new that it's super effective and is the best defense. It's our responsibility to each other.
It is important to get vaccinated to protect yourself and the people you love, as well as everyone around you, and it really lowers the risk of spreading the virus, and it can also prevent serious illness and even death.
We've been focused heavily on the homeless population in the recent months, and that's where a lot of our groundwork happens, because we'll go to downtown Morgantown where the homeless population is largely concentrated, and our interactions with those individuals are on a face-to-face basis. That's actually where the majority of our mind-changing that you can actually witness happens.
We do a lot of outreach with the homeless population, and it's getting to the point where you recognize certain individuals, and that's a cool part about it, because you just establish relationships.
Me and my coworker Clay, we had ran into an individual who was completely against getting the vaccine for multiple reasons. However, I think that it's super important to hear somebody out, at least until the end, so that they will then hear you out. And actually, he ultimately ended up getting the vaccine over 2 weeks after our initial interaction with him, because after that first interaction with him, we had ran into him. Me personally, I'd ran into him 2 times after that, and then he ended up getting his vaccine on the 3rd time after that, and I had spoke with him each time and addressed his concerns, and ultimately at the end, the biggest concern was the effects that it was going to have on him.
Their main fear was they didn't understand. And from not understanding comes the fear.
Yeah, oftentimes it's just because they really don't know how the vaccine will make them feel, or they've been pressured by their peers to not get it. And so talking to a couple of people, I've helped them schedule their first shot.
So I do recall at Christian Help there was an unsheltered individual that said he did not want the vaccine at all, and then throughout the clinic I was talking to him and explaining to him how the vaccine works and listening to his concerns. He was expressing to me that he was worried that he was going to be sick after getting vaccinated, but I told him that it's completely normal for people to feel off after getting vaccinated, and that usually goes away within a couple days. And then by the end of the clinic, he did end up getting a vaccine.
I really have a lot of happy memories so far with this job. I really enjoy the interaction and the connection that we make with people. I like meeting students from the university, finding out what they're studying. I like talking to retirees who are going off on a trip or something like that, and just working people who come into our clinics.
We partner with community organizations such as Christian Help and United Way and Friendship House, which are all based downtown. We go to the Arnettsville Public Library, which is probably one of the further clinics that we've been out to. Just recently, we were trying to work with the Cheat Lake Library.
Yeah, sometimes it is pretty slow. Part of that is trying to fit it at the right time for it to be convenient for people. But it's always still rewarding because we've had folks tell us they really appreciate us coming out because rural areas of the county are often overlooked.
It's really important to connect with people because we can't be overbearing, and it's much better to be part of the community and to make people active participants in their own healthcare and the healthcare of their community. So engagement, interaction, which are my favorite parts of the job anyway, are crucial.